Are you yawning right now just thinking about how soon you'll be able to take a nap? You may have a possible case of sleep deprivation. Many people are affected by this at some point in their life. I know I've been affected, so I started researching the topic. I want to inform you about the effects that sleep deprivation has and how you can detect it and stop it. The American Sleep Association describes sleep deprivation as the cumulative effect of a person not having enough sleep. We know that sleep deprivation adversely affects the brain and cognitive function. Today we'll be discussing how it impacts many individuals, especially children and adults. We'll look at the symptoms, effects, and solutions. Now that you know what sleep deprivation is, let's look at how to detect it. There are many symptoms associated with sleep deprivation. Medical News Today states the main symptom is ongoing sleep loss and excessive daytime sleepiness. Other symptoms may include fatigue, yawning, moodiness, lack of motivation, clumsiness, and many others. One specific symptom is a fuzzy head. After being up for a long night, you're in class. You can't concentrate on anything anybody's saying, and it sounds muffled. Another symptom is yawning. Many people wonder why we yawn. There are many theories to this. The most recent theory is that it cools down the brain by opening the sinus walls and pumping air into the brain. Many people think that yawning is contagious. Sarah Klein stated, one study found that when shown videos of yawning, about 50% of people also began yawning. It even happens among animals. Another symptom may be a depressed mood or overall moodiness. Have you ever had a day where someone just makes you cry? That can be caused by sleep deprivation. Why? It's because of the hormone levels in your body. So, we've seen that the main symptom is daytime sleepiness, and there are many other symptoms associated. Now that you know how to tell if you're sleep deprived, let's look at how it affects your body. There are many effects that it has on the body. First, physically. You can experience weight gain due to hormones. Kathleen Davis shared with Medical News Today that two hormones in the body, leptin and ghrelin, control feelings of hunger, satiety, and fullness. The levels of these hormones are affected by sleep. Another effect it may have is a weakness on the immune system. You may be more likely to catch a common cold or flu. Respiratory systems can also be affected. Obstructive sleep apnea can cause sleep deprivation and make other chronic lung illnesses worse. Sleep deprivation can also have effects on your cardiovascular health. It can affect your blood sugar, blood pressure, and inflammation levels. Not getting enough sleep can cause physical accidents. Little sleep equals little coordination. Another effect it can have is mentally. You may experience memory loss. Have you ever been taking a test after a long night and just can't remember anything that you've learned all quarter, all year? You may be suffering from sleep deprivation. Another thing affected is concentration. Have you ever been listening to your teacher talk and just hear Charlie Brown, wah, 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 wah? Another effect it may have is emotionally. Take mood swings, for example. Someone can be talking to you and then all of a sudden you never want them to say another word for the rest of their life. These effects can cause harm. Ann Pietrangelo and Stephanie Watson explain, chronic sleep deprivation can affect your mood and lead to anxiety or depression, which may escalate. Now that I've told you the effects on the body, let's look at how you can prevent it. Third, there's solutions to preventing sleep deprivation. You can begin with the amount of sleep you're getting. Babies require 12 to 15 hours of sleep, while adults require 7 to 9 hours of sleep. Looking at our age group, we're right in the middle of the two. We require about 8 to 10 hours of sleep. Another treatment you could try is non-medicinal treatments. Cognitive behavioral therapy is used to change patterns associated with certain behaviors. You can help develop better sleeping patterns by this therapy. Stimulation therapy focuses on pre-bedtime schedules to control sleeping patterns. An example of this is only going to bed when you feel tired. Relaxation therapy, you can use muscle tensing and relaxation to help calm the body. Another method is using breathing and audio meditations to induce sleep. Some other solutions may include medical solutions. Over-the-counter medicines such as melatonin, Benadryl, or Unisom sleep tabs. If you are looking for a more natural option, I would recommend melatonin. This is a hormone that controls your sleep-wake cycle. There are prescription medicines that can help too. Lunesta, Ambien, Trazodone, all of these manage sleep apnea, therefore preventing sleep deprivation. Another solution you could try is just changing your home environment. For example, you could start sleeping in the dark, sleeping with a fan on, using a white noise machine, or a humidifier or dehumidifier. The last tip I have on helping to prevent sleep deprivation is to catch up on your sleep debt. For example, if you require 8 hours of sleep and you only get 4 hours, you could take naps in between the day to try to catch up. There are a variety of solutions, and you must find one that's best fit for you. To conclude, I have informed you of an issue that affects almost every individual at some point in their life. Some symptoms may include yawning. Some effects may include memory loss. Some solutions may include over-the-counter medicines. Remember this information next time you don't get enough sleep so you know how to detect and solve problems that come along with sleep deprivation. Thank you.